Welcome to Autism Approved, brought to you by Enzymedica. Now, here's your host, Kristen Selby Gonzalez.
Hi, and welcome to Autism Approved. I'm your host, Kristen Selby Gonzalez. Right now, we are currently in Tampa, Florida, where the National Autism Association is having their yearly conference. We are very excited to have one of their presenters, Scott Smith, here joining us, letting us know about all the great work he's doing. So welcome, Scott.
Well, thanks for having me. I appreciate it.
Well, I know that there's so many great doctors out there, and there's so many great people doing amazing work, and I know you're one of them.
Oh, thanks. I'm glad the good word's getting out.
Well, what I want to know is what gave you that motivation to want to become a biomedical doctor?
Well, I had actually been working here in Florida doing dermatology when my son was diagnosed, and there was not a lot of resources. So I decided to join practice with then Dr. Bradstreet and Dr. Carcinell. Later, Dr. Carcinell was replaced with Dr. Rossignol, and I'd been there for 8 years.
Oh, wow.
Yeah.
Now, what was the inspiration behind wanting to become a biomedical practitioner, I guess?
Well, when my son was diagnosed, there was not anybody really out there to help treat him. We had tried to get into Dr. Bradstreet's practice, and at that time there was a 2-year waiting list. And so I was told that the only way that I could get him around that 2-year waiting list was to join the practice.
Oh my goodness!
So
a little bit of like pushing you in there, huh?
That's right. So I went to Autism by Extortion, and it's worked out pretty good. So it's been a good journey.
Now, how old is your son now?
12 years old.
And how is he doing?
He does well. We're not recovered, but we make progress every single day. He's really blessed that not only does he have me, but my wife, she's a BCBA, so we hit him from both sides of the autism spectrum, per se.
Now, for those out there that don't know what that means, can you define those letters?
Yeah, she's a board-certified behavior analyst,
Okay.
so she has a master's degree in basically doing ABA.
So you have a therapist and a doctor.
Yeah, it's a weird combination, but it works out really good for us.
Wonderful.
So, yeah.
And so paint a picture where your son was.
Cameron was developing pretty normally until about 1 year old, and at that point in time we had a pretty massive regression. What little expressive language we had developed eroded away. Got all the classic features of autism: repetitive play, sensory seeking, became a very poor sleeper, and very bad GI tract problems. And that we struggled with that for over a year. It was hard to get the diagnosis here in the Tampa area. Most of the people were telling us that we were crazy. We were seen at University of South Florida, and we were told that it wasn't autism. We just had PDD.
Just PDD, just pervasive developmental disorder.
That was in vogue back in 2001 to not say you have autism, but to say you have PDD. Then
do you think they did that to make us feel a little bit better as parents?
Well, I think you get to cry at home rather than cry in the office, and they don't have to deal with that. And then a couple weeks later, we faked our way into a neurologist appointment by telling people we thought we had seizures. We walked into the neurologist, not the friendliest man, but he was in the room for about 5 minutes. He got up and goes, "I don't know about seizures, but your kid has autism."
Wow.
And we knew it, and we just wanted that confirmation. And then we went on a journey where we started doing ABA alone, and we made good progress. It was tough to maintain the gains, so when things hit our maintenance type of file, we found that he could learn it but couldn't really maintain it. And then we started adding in some biomedical interventions, and we're able to really get the two to gel and make good progress. So
now, is he your only child?
He's my oldest of two. I have another son, Grant, who is 10 years old.
And is he on the spectrum?
He is not.
He's not. Okay. No. And did you do anything different with that one than you did with the first?
Grant's not vaccinated at all. Had much less of an exposure to antibiotics. Cameron seemed to be sick frequently.
Did he have ear infections and things like that?
Yeah, he had recurrent infections. And then we didn't really spare him with the vaccinations. I remember whenever we were given the opportunity for a vaccination, whether required or not, we thought, yeah, let's do it. We're going to make this kid bionic. And we ended up breaking him. My wife was really hesitant about a lot of the vaccinations that I did agree to. But we didn't really know what we know now back then.
You're just doing the best we knew how. I mean,
we thought we were trying to make him as healthy as possible. Unbeknownst to us, we were really breaking him every single time we did it.
Well, I told you before we started the interview, I have a 9.5-year-old, and I was in the same boat. I mean, I think many of us parents that are out there and those watching, we just try to be the best we can, try to.
I hear you.
We look at the research and, until this happens to you, and if this hasn't happened to you yet and you have a friend this has happened to, then you'll understand until you can walk in somebody else's shoes. It's just one of those moments, you just.
I totally agree. I don't think anyone understands what we go through every day as parents. That's what makes myself and a couple of the other providers out there with kids on the spectrum of their own. I think people like to talk to us because we've not only do it for work, but we live it at home. So the hardest part of my day is when I get home. So I tell everybody I'm in charge of about 3,000 kids with autism, but the one at home is the toughest.
And I have heard that from many practitioners where their own case is harder than some of the others they work with, and so, but I'm so grateful as a parent that there are doctors out you, I mean, like you out there that are, standing up with us and walking that walk and fighting that fight because, I think there's so many times people just really don't understand. As much as I wish it didn't happen to you, and I think that they always say the cliche of it always happens for a reason, I guess.
Yeah, I would agree. I say that all the time, and I think you're never given more than you can handle, and so I think this was a really unique opportunity. And I'm a big believer that what comes around goes around. So the more kids I help, the more that my Cameron is going to be helped as well. So
I say the same thing constantly because I see so many other children, we help them with diet or we help them, by introducing them to doctors like you. And then, with my own son, he's my toughest case. So,
right.
I can absolutely relate to that. Now, one of the things that you have been specialized in with working with individuals is PANDAS.
That's right.
Can you tell us what exactly is PANDAS? I know it's not a koala bear or a bear. So I know if I'm a parent out there for the first time, I'm thinking, what? I've heard of it, but how do we define that, I guess, in mommy terms?
Sure. So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Dysfunction After Streptococcal Infection. So what happens is when the body makes an immune response to strep, it makes it just a little different than it's supposed to make it. This allows the antibody to cross-react with parts of the brain to lead to the symptoms of PANDAS. PANDAS is classically an acute onset anxiety, OCD, or tic disorder.
Okay, and how do you test for that?
Well, there's no definitive test. It's based off of clinical symptomatology. You really like to try to build as best of a case as you can to be associated with strep. So initiation of symptoms around a strep infection is pretty clear case. But sometimes the child doesn't even need to be the one with strep. Sometimes it could be a sibling or a schoolmate.
Wow.
That could be the strep, and the child's body upregulates the antibody production in anticipation of a possible infection. It's the antibody that really causes the problem, not the strep per se.
And so is that when we see children that have OCD or tics, is that like an indicator that we should look for PANDAS?
Well, I think if you have an acute change in your OCD, then yes. OCD and repetitive behaviors is part of the diagnostic criteria for autism in and of itself. So the lecture I gave here today was trying to figure out where does autism end and where does PANDAS begin, because for kids who have both, the line is not quite as clear as we'd like it to be. For neurotypical kids, when you have PANDAS, the changes are so dramatic and so acute that the parents are on a mission, because on Thursday, little Johnny went to bed normal, woke up on Friday and he's broken. For kids with ASD, we often spend weeks or months trying to figure out what else went wrong, rule out yeast overgrowths and bacterial overgrowths, and do we have a dental problem, and do we have constipation issues? And the longer you go with PANDAS before you initiate treatment, the more refractory it becomes to treatment.
And so how many children are you seeing currently? I mean, I've been hearing about PANDAS now for several years, and it seems as though I'm hearing more and more cases, come, I guess, to light.
Yeah, I think we're better understanding PANDAS. I think I first heard about the term PANDAS probably around 2002, 2003. Some of the earliest literature on it go back to the late 1990s. So we're still talking about something in its infancy. Some rough predictions are about 500,000 kids,
wow,
neurotypical kids in the United States have PANDAS. That doesn't include every year newly diagnosed, and that doesn't include our kids with ASD where maybe the diagnosis is being missed.
And so what's something that a parent that's watching right now, if they're concerned on that, how do they, I guess, approach their doctor to be able to figure out if their child does have PANDAS?
Sure. I mean, that's a great question. So I would definitely get the child worked up for strep. I'd get family members worked up for strep. Make sure you sit down and write a really complete history. If you visited, your sister and her kid was sick, follow up with that. What happened? Did you take him to the doctor? Was it strep? Try to get as good of a timeline as you possibly can. I had a case recently with a child from Pennsylvania where he had a 3-year history of a tic disorder. When I went back and reviewed the notes, the doctor had clearly wrote in there 3 years earlier that the tic disorder started within 3 days of a culture being positive for strep.
Wow.
But then wrote specifically that this can't be PANDAS because his ASO was not positive. ASO is an antibody to strep that can be measured in the blood. So there's just a lot of bad information out there right now, again, because it's so new. It's a bit controversial. I think if we get everybody on the same page, more kids will be able to be helped.
Now, this is probably a silly question, but I'm thinking, if I'm a parent out there and this is new to me, I always try to go back to, trying to remember what it was like when I was trying to get all this information to begin with. So what I knew about strep, before I ever had a child with autism, is you go in for a throat culture.
Sure.
So is that the same kind of thing that they do?
Yeah, except for you can have strep in multiple areas. I mean, it doesn't necessarily be in your throat. So if all you did was the throat culture, you're really only checking one potential source.
Is that almost like the flu vaccination? When you get the flu vaccination, you're only really protecting yourself against one or two strains.
Kind of, yeah, because you could have strep as a sinusitis, and the culture would be normal. You could have strep in your GI tract, and your culture would be normal. Your throat culture would be normal. You can even have strep on your skin, and it causes a condition called impetigo, and your throat culture would be normal.
So the blood test, is that the only other way, or is there stool or?
Well, the